It's Monday, August 31. This is the news on PBCJ. I'm Simone Absalom. Jamaica's Ministry of Health and Wellness has opted for a targeted approach to limiting the spread of COVID-19. They had promoted the wearing masks, social distancing, and asking people with respiratory problems to stay at home. Cases of the novel coronavirus in Jamaica held low for months and have now surged to 1,347 active cases. The ministry has ramped up its efforts distributing masks and sanitizers to transport operators and passengers. Marlon Samuels has more in this report of what took place in Halfway Tree Monday morning.
As the government stepped up its health response to the COVID-19 pandemic, health personnel led by Minister of Health Dr. Christopher Tufton took to the streets. They began distributing free, reusable, protective masks shortly after 7 Monday morning at the Papine University taxi stand in Kingston. Taxi drivers, passengers and pedestrians received up to 2 masks each.
It's not the first time that we're going out. We've been out in the different communities trying to get the message out about wearing masks. And the taxi stand in the heart of Halfway Tree is a good place because that's where a lot of people congregate. That's where the cab drivers are. That's where the message can be really made. And hopefully they will take it beyond this particular journey to other people. So we're doing it across the country, and we're going to be doing more of it because, as you can see, the COVID issue is a big issue and we really need to do more to get people to comply with the rules.
Dr. Tufton took time out to reason with vendors and people waiting to board taxis.
Everybody is vulnerable. Both in the uptown, in the downtown, in the middle town, in the on the bus, in the taxi, right? In the on the playing field, in the community, in the workplace. People need to stop things say it's only some people who get it. Anybody can get it. And the mask wearing is very important. So if you carry the message out there, make people understand that that is important. You understand? So you need to live by the rules and reduce the risk to yourself.
I appreciate it so much, believe me. I respect him for this because people wear their mask and see me have on my one and I still take off when this dirty or sometimes I'll drop them, I have to find one next one and I'm on the road. So I'm glad for it, I respect them. Big up to the minister.
The distribution of masks by the Minister of Health and his team continues on Tuesday morning, September 1, at the Lashushan Supercenter in Barbados. Barbados is one of several locations in Kingston identified by the Ministry of Health where COVID-19 cases have risen. For the news on PBCJ, I'm Marlon Samuels.
Another COVID-19 patient died in the last 24 hours. This brings the total number of COVID-19 related deaths to 21. We have more in this COVID-19 update.
The Ministry of Health and Wellness says the deceased is a 28-year-old woman from St. James. In the meantime, the country recorded 245 new cases. This brings the total number of cases on record for the island to 2,357. The country is now managing 1,374 active cases, including 14 moderately ill patients and 4 critically ill patients. Of the newly confirmed cases, 116 are females and 100 are males, with ages ranging from 2 weeks old to 90 years old. Of the new cases, 92 were recorded in Kingston and St. Andrew, 62 in St. Catherine, 27 in St. James, 15 in St. Thomas, 9 in Portland, 8 in St. Anne, as well as Clarendon, 7 in Manchester, 6 in St. Elizabeth, 5 in Hanover, 4 in St. Mary, and 1 in Trelawney and Westmoreland, respectively. To date, 890 persons have recovered from the virus. For the news on PBCJ, I'm Gabrielle Thompson.
Effective September 1, the government will be engaging 121 medical professionals to boost the country's efforts against COVID-19. Health Minister Dr. Christopher Tufton provided details at a recent virtual press brief at the ministry's New Kingston offices.
We are well advanced with the employment and deployment of 121 medical officers. You would have recalled a discussion around those medical officers who did not have posts in the public health system. We have gotten the go-ahead to engage these persons, and I am told now that we will have contracts effective the 1st of September to engage these 121 medical officers. So in less than a week, those medical officers will be deployed, and that will bolster the numbers in the field and certainly assist as it relates to the COVID response.
Dr. Tufton said that along with the ongoing national recruitment drive for community health aides, they will be creating a new post, which is that of the public health inspector.
In addition to that, we have 750 community health aides that are deployed. We're moving to the 1,000 mark, so recruitment is still on. Again, that will be a big addition to the cadre of workers in the field and will help us with the intelligence gathering and information flow, contact tracing, and so on. Beyond that, and I'm announcing this, I don't know if it's the first or second time, I may have said it before, we're moving now to another category of public health workers that we are expanding, and that is our public health inspectors. And we're in the final stages, the Office of the CMO, working with the regions to determining a number of public health inspectors who will be engaged. And the public health inspectors are very important to the process. They are at the local parish level. They go out in the field. They assess what is happening. And one of the primary reasons for engaging them is to provide leadership in terms of, the community health aides to assist with that. Public health nurses do the same thing. But importantly, they will be used to drive the protocols that are in place to ensure that whether it's workplace, community, or otherwise, any protocol that is established around the response to COVID. Remember now we are about living with COVID, and so COVID is around. The numbers are reflecting that very clearly. Those public health inspectors will help to police, if you will, those protocols, supported, of course, by the rest of the team. So they are an important part of the response to COVID, the expansion of that cadre of workers. So in short order, we will make public the numbers and we will start that process.
The government has released new protocol which will allow for COVID-positive people in isolation to go out and vote in the Special Services poll today or during Thursday's general election on September 3. Members of the security forces and election day workers will vote today. In a statement released shortly after midnight, the Office of the Prime Minister said people in isolation will only be allowed to vote between the hours of 4 p.m. and 5 p.m. and under strict guidelines. These include private transportation to and from the polling station, the wearing of masks, sanitization, and social distancing of up to 6 feet. Just about 45,000 election day workers and members of the security forces are expected to go to the polls today, 3 days before the general public will mark their vote. The Electoral Commission of Jamaica has said voting will take place island-wide between 8 a.m. and 4 p.m. in 169 locations for the election day workers and 28 locations for the police and military. Under the Representation of the People's Act, provisions are made for military and police personnel as well as election day workers to vote 3 days before the rest of the population to ensure that they are available for duty on election day. Director of Elections Glaspel Brown is urging Jamaicans to wear a mask when they visit the polling stations on Election Day, September 3. He made the plea while giving an update during a digital press conference on planned processes of voting during the general elections.
And again, I just urge everybody who is listening, ensure that when you come to the polling station that you have on a mask. There are persons who might ask why the EOJ or ECJ does not provide masks. On the list itself has 1.9 million persons. It's impossible for us to provide that. So therefore, we urge everybody to come to the polling station and wearing a mask.
If you need any information about Election Day, there's an app for that. It's linked to the Electoral Commission of Jamaica's website, www.ecj.com.jm. Mr. Brown shared avenues of getting information with the Jamaica Information Service.
you could contact one of our offices across the island. We have 70 offices across the island. Every constituency have at least one office. And also you could call into our toll-free number. You could call our head office, or you could go on the website. And the website will direct you to where your vote is. So there's a number of channels, a number of areas that you could get that information.
University of Technology UTECH's Papine campus is closed because of a confirmed COVID-19 case on the campus. Acting President Professor Colin Giles of UTECH sent out the advisory stating that no one will be permitted to enter the campus during this closure. Classes and services will be delivered online. Professor Giles says further updates on the reopening will be communicated. Containment protocols have been activated at the Horizon Adult Correctional Facility following the confirmation of 5 COVID-19 cases on the weekend. A response team from the Kingston and St. Andrew Health Department will be visiting the facility to meet with the team to assist in managing possible anxiety among prisoner and staff populations. And the required volume of personnel protective equipment for staff and inmates have been distributed to the facility in accordance with the Ministry of Health and Wellness recommendations. Former Minister Dr. D.K. Duncan has tested positive for COVID-19 and has been admitted to hospital. A statement from his family says after experiencing some signs of sinusitis and tiredness, Dr. Duncan did a COVID-19 test and the preliminary results received indicate that he is positive. The Cannabis Licensing Authority, CLA, says it's aiming to achieve certification in International Organization for Standardization, ISO 9001-2015. The CLA's goal was disclosed at a JIS think tank session by Director of Research, Development and Communications at the CLA, Felicia Bailey.
Currently, we are over 50% of that implementation, and this may make us the first cannabis regulator worldwide to be ISO 9001-2015 certified.
ISO 9001 is an international standard that specifies requirements for a quality management system, QMS. ISO certification is part of a strategic public sector transformation project of the Ministry of Finance and the Public Service. Ms. Bailey says the authority views ISO 9001-2015 certification as another way to develop and grow the medicinal cannabis industry. And Gabriel Thompson now gives us a rundown on the stock and forex markets along with other news in the business report.
In Friday's trading session, the JSE combined index declined by 765 points to close at under 400,000 units. Overall market activity resulted from trading in 71 stocks, of which 26 advanced, 32 declined and 13 traded firm. The junior market index declined by 4 points to close at under 3,000 units. Stocks advanced for Caribbean Assurance Brokers Limited, Caribbean Cement Company, and Caribbean Cream Limited. Stocks declined for 138 Student Living Jamaica, 1834 Investments Limited, and Barita Investments Limited. Trading firm were Siboney Group Limited, Community and Workers of Jamaica Deferred Share, and Consolidated Bakers Jamaica. Carreras Limited was the volume leader with over 40 million units, followed by Sagicor Select Funds Limited Manufacturing and Distribution with just over 8 million units, and Wigton Wind Farm Limited ordinary shares with 4.2 million units. Now for the foreign exchange. The US dollar on Friday, August 28 ended trading at $149.59. The Canadian dollar sold for an average $115.25. The pound sterling traded for $196.91, and the euro ended trading at $179.86. Oil prices nudged up on Monday with Brent futures set to post a fifth straight monthly gain as global stimulus measures underpin prices, even as demand struggles to return to pre-COVID levels in a well-supplied market. Brent crude futures climbed 27 cents to $46.08 a barrel. West Texas Intermediate crude futures gained 14 cents to $43.11 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
In regional news, Prime Minister Dr. Hubert Minnis is appealing to all Bahamians and residents to remain vigilant as the country begins a phased reopening on Monday. More details in this report.
In a 15-minute-long national address, Dr. Hubert Minnis cautioned all Bahamians to follow the health measures, especially here in the capital and on Grand Bahama, when the number of cases remains high. As of yesterday, the national tally shot up by 78 cases to 2,135 cases. 63 are in New Providence, 4 on Grand Bahama, and 11 pending locations.
As we begin this gradual and phased reopening, I remind you to please follow the well-known health and life-saving measures, particularly wearing your mask, maintaining appropriate physical distancing, and staying at home when you do not need to be out. Do not let your guard down. We are still in a marathon fight against COVID-19.
Dr. Minnis encouraged all Bahamians to ensure their employees and customers follow the proper health safety protocols, proper sanitization, physical distancing, and the wearing of masks or facial coverings. The competent authority also announced effective tomorrow the resumption of services for several more businesses.
The new orders were designed to ensure that more small business could open with appropriate health measures. For example, here on New Providence, Grand Bahama, and on the islands in the second schedule of the order, barbers and beauticians may open with one person per service provider. Landscape service providers may operate Monday through Saturday from 7 a.m. to 5 p.m.
Public transportation will also be allowed to operate beginning tomorrow at 50% capacity. On the religious front, Dr. Minnis says a determination will be made on when in-person church services and other congregant activities can continue. Until then, worship services here in the capital may be live streamed from a facility with no more than 10 people in attendance. And as government works to strike a balance between the health, economic, and social needs of the country, Dr. Minnis touted some of the achievements in the fight against COVID.
We have increased hospital capacity, including for COVID-19 patients, created a COVID-19 enforcement unit, increased testing capacity, improved the turnaround time for test results, and generally improved the analysis of health data. Of course, there is still more to be done in terms of our health responses, and we are doing so.
As the country seeks to flatten the curve, the Prime Minister again called on all Bahamians and residents to do their part.
I was very disappointed passing the construction site at the point on Bay Street, where all Chinese workers were wearing masks, but the Bahamian workers were not. We should all be vigilant in terms of safety and security during the phased reopening of the economy.
Now, also from the national address, the Prime Minister announcing that Education Minister Jeff Lloyd will provide a comprehensive update on the upcoming academic year tomorrow during a national address at 3 p.m. For further details related to the religious and educational institutions and for specific commercial and social activities, you can visit opm.gov.bs or the recommended social media platforms.
A survey conducted by the Barbados Chambers of Commerce and Industry shows businesses, particularly those in retail and distribution sectors, are feeling the pinch of COVID-19. More in this report.
According to the head of the BCCI, Tricia Tanis, data from a survey of members point to steadily declining sales and revenue, with many businesses already having to cease operations. And it is for that reason the BCCI is strongly objecting to claims that local businesses were using the COVID-19 pandemic to make job cuts that were in the pipeline prior to the health crisis. Tanis said there was no evidence to support the claims.
Notwithstanding a temporary increase in sales in the month of March, retailers and distributors who remained open during the curfew have reported steady reductions in revenue as high as 25% over the period April to July this year, compared to the same period last year. Retailers that were closed during the curfew reported more significant slides, upwards of 35%, for the same period. Of equal or greater concern is the negative outlook for the foreseeable future, which results from observed declining foot traffic as high as 20% in various sectors, and extremely thin margins, particularly in the supermarket sector, which is wholly dependent on significant volumes generated by foot traffic and customer spend to cover overheads. Secondly, the continued closure of critical veins in the economy, such as the hospitality sector and food and beverage sectors, and those engaged in activity to support school preparation, have all contributed to unprecedented reductions in economic activity as pipeline demand has shrunk and continues to shrink.
Tanis called on all stakeholders to understand the gravity of the economic situation based on the data, which she said clearly showed a continued decline in revenue and high unsustainable levels of overhead costs for many businesses, particularly those which were closed during the curfew.
This has had a direct impact on their ability to sustain the business modalities and structures that existed prior to the COVID-19 crisis. Overheads and other structural costs, including rent and staffing levels, have been reduced, resulting in physical locations being closed, opening hours being shortened, and the unfortunate downsizing of staff costs witnessed to date. These actions have not been taken with any perverse motive, which recent media comments seem to suggest, but ironically, in the interest of preserving the livelihoods of as many employees as possible by averting total business failures. We urge and encourage responsible and informed commentary as we work together to recover from the current economic downturn. Emotive and inflammatory comments serve nothing to advance our national and collective well-being.
No fanfare and no parade this year, as the COVID-19 pandemic has caused the government to shelve all celebrations, including plans for Independence Day. Crystal Wilson takes a look at the quiet side of Independence Day celebrations.
Monday, August 31st, the Queen's Park Savannah will be empty. There'll be no crowds, no spectators, and no military parade, as COVID-19 has forced the cancellation of this year's event.
A milestone for this country, as Trinidad and Tobago this year marks its 50th anniversary after gaining its independence from Great Britain. Citizens usually commemorate the event by wearing their best outfits in red, white, and black. Parties are usually held on or before Independence Day, and on the morning of August 31st, the armed forces would usually gather to display their skills at the Queen's Park Savannah. But this year will be notably different, with government announcing as a result of the COVID-19 pandemic, there will be no national parade. TTT News met with commanding officer of the Trinidad and Tobago Air Guard, Group Captain Kester Weeks, who said the cancellation of this year's event was no surprise given the circumstances. He explained it's not the first time independence celebrations have been shelved in the years 1970, 1990, and now 2020.
1970 would have been on the back end of the revolution times in Trinidad and Tobago. And as a result of that, you would have found that those types of outward shows of force would not have been really appreciated at that time.
Commanding Officer Weeks said the members of the TT Air Guard share with the rest of the population concern about the COVID-19 pandemic. He noted, however, there's some disappointment among his troops with the cancellation of this year's parade.
More than that, it also allows for a chronicle of the growth and development of our armed forces and our unarmed contingent. Because if we would historically look back on the several parades, we would recognize how things have grown, how things have developed, how new units have become involved. And so it, in essence, is a historical chronicle of the growth and development of Trinidad and Tobago.
He took some time and reminisced about his own childhood, having attended annual Independence Day parades perched on the neck of his father. He shared what it feels like to be on the other side and among the troops now, having the children and other spectators admire their skills displayed in past parades.
I have very fond memories of looking at the military and the paramilitary passing by. At that time, I would never have thought that I would have been one of the participants. But on the other side of it now, as being on the parade, it is a wonderful feeling to see the very young generations of Trinbagonians admiring, looking on.
In sports, we look at football. The United Soccer League, USL, recently named a top 10 list of regional players for this season. That list saw Jamaica and Phoenix rising star Junior Flemmings topping the player pool from the Caribbean. 5 other Jamaicans are on this elite list. Caribbean players make up a great percentage of the league's players, and the USL website noted that some of the best players in the championship have their roots in the region. It also pointed out that 3 of the competition's first 4 MVPs came from the Caribbean. And that's the news on PBCJ. Thank you so much for watching. Do remember, stay safe.